There are two immunotherapies that are FDA approved for the treatment of head and neck cancer. These are nivolumab and pembrolizumab. And in each case, the drug has been approved for platinum refractory disease. And platinum refractory is defined either as the person has had platinum-based chemotherapy for recurrent metastatic disease and progressed through it, or for those patients who got platinum with their chemoradiation, their recurrence or their metastasis developed within 6 months of their most recent platinum dose. And so that is the accepted standard. The response rates are modest, but the survival effects seem very real and durable. And so for a patient who's had platinum-based therapy who recurs, nivolumab or pembrolizumab would be the appropriate standard of care. Now the question is, what about earlier stage patients? And is there anything we could do to augment the response rate? Because we're looking at response rates of about 14% for nivolumab, perhaps approaching 20% for pembrolizumab. And there are a couple of different ideas. One is to intensify the immune response that you generate from these agents by improving the priming. And so there's a trial that compares nivolumab with nivolumab plus ipilimumab, and then compares that to standard of care chemotherapy and cetuximab. And there's another study that takes the PD-L1 drug, which is not yet approved in head and neck cancer. So durvalumab alone, or durvalumab plus another CTLA-4 drug, tremelimumab, or the reference standard of chemotherapy and cetuximab. And so those trials are progressing. We're all looking forward to the data from those. As the viewers will know, adding a CTLA-4 drug definitely increases the toxic burden on the patients. And so people are interested in other targets as well. And so there are trials moving forward with PD-1 inhibitors and IDO-directed drugs. And an area that I'm quite interested in is the integration of immunotherapies with standard therapy, because chemotherapy in head and neck cancer is not bad. It leads to a lot of responses. Some of them last, for a number of months, and the cell kill that you achieve from chemotherapy might actually be a very efficient way of shedding antigens and allowing the immune response really to be effective against the cancer. So there's a recently completed trial that compares pembrolizumab with the standard of care chemotherapy and cetuximab, and then a novel regimen of chemotherapy with pembrolizumab. And that study has completed accrual, and we're all very interested to see those results. Similar trials are ongoing looking at immunotherapy combined with radiation or following radiation. So it's a very exciting time.